But first, we're going to hear from Dr. Jason Flatt, who's an assistant professor at the University of Nevada, Las Vegas School of Public Health in the Department of Social and Behavioral Health. Dr. Flatt, thank you for joining.
Thank you so much, Nicole. So I really want to talk with you a bit about sexual and gender minority populations and really thinking around disparities in care. So next slide. So language matters. And so today I'm going to be using the terms sexual and gender minority and LGBTQIA+ interchangeably. So I want to start off with defining these. So sexual minority, this represents an individual that may identify as asexual, bisexual, gay, lesbian, or queer, or they may use a different term, but they do not identify as heterosexual. Also, the term gender minority, this reflects individuals who may identify as transgender or non-binary, or they use a different term to describe their gender identity and or expression, and they do not see this aligning with the sex that was assigned to them at birth that typically aligns more with social and cultural expectations. This also includes intersex people who are born with differences in their sexual development. You will see the term cisgender, which reflects people whose gender identity aligns with the sex that was assigned to them at birth. It's important to note that you could be a sexual and gender minority, or you may just be one. So next slide. So we're seeing a growing number of our aging population who are identifying as SGM. We estimate that this is nearly 3 million people and likely is going to more than double by 2040. Around 1 in 5 members of the community are racial ethnic minorities. We know a third of them are living in poverty. And so when we're thinking around access to healthcare, we know there are many barriers for the community. And likely these intersect with unique experiences and factors, such as race, ethnicity, not having access to some of the same supports that cisgender heterosexual people have. So things like access to marriage, not living alone, and having caregiver support. So next slide. So I want to emphasize what is happening currently in our country that are really impacting access to care. So we know both historically and currently that sexual and gender minority people, their identities have been considered a mental health disorder. We still see this for transgender people that require a diagnosis of gender dysphoria to be able to access care. We also know the community lacks protections for basic human rights, especially healthcare. And what we're currently seeing across our country are attacks at transgender affirming care. So I show at the top a map that just highlights all the states that are currently passing policies to restrict care. They first have targeted this at transgender youth, but now it is starting to apply to adults as well. So for instance, we know Missouri just blocked access to care for transgender people, and we know tomorrow Ohio is voting about this. So we're seeing a major spread in our country. And when we think about basic rights for aging, we see unique concerns for the sexual and gender minority communities that affect their access to inclusive care. And this intersects with things like race, ethnicity, gender identity, HIV status, and abilities. Next slide. So I want to highlight just some research. Actually, our moderator, Dr. Rosendell, led this study that basically highlights there are major gaps in understanding in terms of central nervous system disorders among SGM populations. There is very little research. There were around 350 studies that were published over the past 40 years, and most of them focused on cisgender men. Very little on older populations. Next slide. So we are seeing higher rates of memory problems for the sexual and gender minority communities. This data comes from the National Behavioral Risk Factors Surveillance System. And we see that less than half of people who are having these problems have access to healthcare or talk to their doctor about the problems. Next slide. So a unique study led by a colleague, Nicholas Lambro at University of Wisconsin-Madison, showed that for transgender people who are reporting these memory problems, they are more likely to say they have experienced discrimination in medical settings. Next slide. We also see a unique study that was just published that found that LGBTQIA+ people with Parkinson's disease, led by Ezra Byram at UC San Diego, are reporting more perceived discrimination in healthcare, things like receiving poorer service and healthcare providers not listening to them. Next slide. I want to highlight the NASM report that came out recently that calls for the NIH to be thinking about the collection of sex, gender, and sexual orientation. I encourage you to check this out as a way to think about making care more inclusive. Next slide. So we need more research. We need to be thinking about promoting resilience and training our healthcare workforce. We need to collect data on sexual orientation and gender identity and be thinking more about research for our community. We have a unique study called the RISE Registry, which is the first federally funded registry for SGM people with memory concerns and their caregivers. We need to support SGM caregivers, families, and make sure care is inclusive for everyone and support others to move into this work. Next slide. So these are my disclosures. Next slide. And I look forward to talking to you during the discussion. So thank you so much.
Thank you, Dr. Flatt. Certainly a lot to talk about, and I'm excited for our panel.